Gym versus yoga. I'm Dr. Amitabh Satsangi from Department of CTVS AIMS, New Delhi. There is no doubt that both gym and yoga share the same goal for fitness and health. However, they both have a very different approach and a purpose when it comes to health. While the gym exercises are solely designed for your physical fitness, yoga benefits your whole mind, body, and spirit. Here we have come up with some benefits and differences between yoga and gym so that you can decide which is better for you as per your individual requirements. Now, next, as we talk about gymming, a gym is a place people come to exercise on various machines to lose weight, strengthen their muscles, and increase muscle strength. Gymming is more like a power booster. Gymming strengthens your muscles, makes you sweat, hence removal of toxins from the body, relieves stress as working out releases endorphins, which uplifts the mood, burns all the extra calories, and increases your appetite. Yoga is a discipline that has steeped into culture and tradition that is thousands of years old. Sages and seers have used yoga to keep their bodies and mind fit so they can be prepared for a seated meditation. Yoga aims at holistic development, it enhances your flexibility and regulates your mind. Some of the benefits of yoga are it keeps you energized all day, it improves the blood circulation and digestive system, hence the removal of toxins. It is highly beneficial for you if you are dealing with any chronic health conditions. You can practice it anywhere in your home garden without needing any specific dates. So what are the differences between yoga and gym? So the differences that usually come between yoga and gym are that accessibility. Yoga is a typical yoga session does not require you to spend a lot of money and time, and you can do it anywhere or you can join a studio. Whereas in a gym class, you need to have a membership. You will need a trainer to guide you through various equipments and exercises, plus a risk of injuries. In yoga, since it is beginner friendly, there are very less risk of injuries. In gym, though, because of equipments and many exercises, there is a greater risk of injuries involved. In mental being, yoga focuses on mental well-being, whereas gym does not basically focuses on physical health. On overall well-being, yoga works on physical as well as mental aspect, whereas gym has more benefits of doing cardiovascular health and performance release. For inclusivity, yoga, a specific yoga medicine designed for people for suffering from various injuries such as back and cervical, though gymming has to be a guided procedure. In eating habits, yoga makes you mindful, hence there won't be a chance of binge eating. A good gym session makes you more conscious of your eating habits as you don't want to binge eat after a exercise session. So there are variety and levels available both in yoga and gym. Yoga offers you a variety as there are so many forms of yoga. If you think yoga is boring, try taking a yoga challenge. It might surprise you. Gym basically concentrates on various muscles and various body aspects and cardiovascular aspects. So you can always include variations in your exercise. So yoga versus gym, which is for you? If you are living a sedentary lifestyle, yoga might be a good start for you, and you can do also a combination of both yoga as well as gym. So physical activity is a dire need of human body to remain fit and healthy. Yoga and gym are the two most popular and effective ways of achieving physical fitness goals, and deciding the right ones for you is highly subjective. It depends on goals, needs, and physical caliber and strengths of a person. So consider all the factors of your lifestyle and then choose the right one for you. Doing something is better than doing nothing at all.
Hello everyone, good morning. This is Harpreet and I'm a clinical physiotherapist and I'm based in Melbourne, Australia at the moment. First of all, I just want to congratulate everyone for this very amazing occasion of World Yoga Therapy Day. Congratulations everyone. And I also want to extend my heartiest thanks to Dr. Deepak for inviting me on this platform. Very thank you. So I'm given this topic to discuss a little bit about what are the trends in Australia regarding the prevention and management of cardiovascular diseases. Well, I would say it's a vast topic, but I would like to cover up as much as possible in a short duration of time. So if you have a look here, as a physio on the slide, uh, we have four major roles in cardiopulmonary conditions. The first one is preoperative, then another one is ICU management, then post-operative management, and we all are very much aware of that. And I'm not going into detail for that. But I would like to address today about the cardiopulmonary rehabilitation, which is quite good in Australia. And I'm very impressed with these settings which are happening here in Australia. Now, this cardiopulmonary rehabilitation, it can be community based, it can be government run program, it can be hospital run program, or it can be a private clinic. setup as well. So, what is cardiopulmonary rehabilitation basically? It is the rehabilitation which takes place after a person has undergone any kind of surgery for the heart or the lungs, or maybe they are suffering from some chronic condition for the same. And after that, we have to go for the cardiac rehabilitation. Uh, so it is an exercise and education program that supports you while you are recovering from any heart and lung procedures. This service has also been proven to help the patients to be alive and out of the hospital for a long time. And it's a very, very important step, which is very important to take on the road to recovery. Now, cardiac rehab also encourages a person to make some lifestyle changes which can help them to heal their heart and lungs better and become stronger, which means they can live healthier with better quality of life. In cardiac rehab, what you are receiving now, you are going to have a support of the team. The team comprises of cardiopulmonary surgeon, a specialist, some of the general practitioners, physiotherapists, exercise physiologists, social workers, then family support, occupational therapist, and if required, we also work on quitting the smoking and alcohol, and we try to manage the lipids and also the uh, diabetes, and we have nutritionists on board as well. Now, in this, we give a health program. Before giving the health program, we basically undergo a complete assessment. As a physio, we have a very specialized lab in which we do cardiopulmonary assessment, which include the stress testing, in which a person is basically running or walking on the treadmill, and we check their heart rate and all the other readings of the heart. Or it can also be pulmonary, in which we check the breathing in, breathing out, the tidal volume, total lung volume, and how the person is basically breathing. Okay, so that is like a base for us. Once the initial assessment is done, then we go for the tailor-made exercise plan for that particular patient. So basically, who are taking this cardiac rehabilitation? As I told you before, anyone who is suffering from heart and lung diseases, chronic lung diseases, or they have already undergone any kind of surgery to address them. Uh, so, what are the benefits of cardiac rehabilitation? It helps to reduce some of the chances of having the heart disease or lung disease. Again, it ensures that you should not be going back to the hospital. It encourages you to participate and do more activities, and it keep your weight and of course diabetes on check. It encourages you to exercise regularly and quit smoking. It make you feel hopeful and better about yourself, and it also enable you to understand your heart disease and your own treatment plan. Now, what happens in the cardiac rehabilitation? Basically, in the beginning, one of the member of healthcare team, usually the physiotherapist and the GP together, they go for the complete health assessment. And we are going to ask you your lifestyle questions, your family needs, and what are your expectations. And based on that, we are going to give you a personalized exercise and treatment plan. You can have a look here that it's a small way how we do some assessment, in which we place electrodes all over your body, and we're gonna read some of the readings about your heart while you are walking on the treadmill. And the other one you can see here again, as same here, but we are using the equipment where we are basically checking your breathing in, breathing out while you are doing some walking or sitting or certain activities. Now, once you are into this rehab program, you will get support for many things, because you may need certain few things out of that, or you may need all of them. Now, what it can be, it is to improve your diet, to help you manage your weight, quit smoking, manage medicines, manage your other conditions, which can be hyperlipidemia, diabetes, blood pressure. It helps you to recognize your early warning signs, like next time you should know that, okay, these are the signs, now I should be doing something. Manage your stress, anxiety, and depression, very, very important. And also, if you have certain questions to address, we are always there to help you with that. Now, while you are getting this support, we also ensure that a person should be self-managed and self-sufficient in the emergency situations. They are well prepared for any kind of emergency in the future as well. So we really don't look forward to a person who is dying out of the heart and lung condition just because they were ignored. They were not very aware what to do in the emergency situations. Here you can just have a look that we talk about a little bit of core components of cardiac rehabilitation, where we say it's a patient assessment, nutrition, counseling, weight management, blood pressure management, lipid management, diabetes management, tobacco cessation, psychosocial management, and then we have physical activity and exercise training. All these are the basic components of cardiac rehabilitation. And in the end, I just want to say thank you. I have gathered this information from St. Vincent Hospital Australia and Heart Foundation Australia. You can go on these websites and browse more. Though it's a vast topic, I just try to put in everything in a small setup. Uh, I worked across in India for 5 years, and I had a good experience with the cardiac and pulmonary rehabilitation patients. But what I personally feel that what we can work in India is about the cardiac rehabilitation structure in place, which is very, very good here in Australia. See, when a patient is in ICU or in the hospital, everything is taken care. But now, what happens once they are back in the society? How we have to bring them back to their job, their employment, how we have to fit them into the recreation activities, how they are going to take the family burdens. Are they going to be a burden to the family, or are they going to take the burdens of a family? So we really make them equipped. Usually this program run for 6 to 8 weeks, but a person can keep on participating in these programs. And we also have a lot of support groups over here. With that, I'm done, and back to you guys. Hopefully I will see you very soon here in India as well. Good night from Melbourne.
Good afternoon, everyone. A very happy yoga day to all of you. First of all, I would like to congratulate Dr. Deepak Puri for spreading awareness in the society about how to keep heart happy. I have been associated with Dr. Deepak Puri for more than 10 years, and his passion for Cardiomersion is commendable. He has been contributing to the society greatly about the awareness, about the risk factors that prevail for the heart attacks, about how to keep heart happy with singing, at the same time being a very thorough professional. In today's time, I have seen a lot of patients coming to us with a very irregular protocol they follow for the medicine of blood pressure. I would like all of us to understand we must analyze the risk factors that can stress our heart. We have to avoid that. As far as people having blood pressure is concerned, I have seen they don't follow a regular protocol wherein they take medicine for blood pressure on their own without understanding the importance of blood pressure medicine in keeping their heart healthy. I would like to request every one of you to kindly make sure for your near and dear ones that they must follow proper protocol in taking the blood pressure medicine. Another very important factor that I have seen in preventing cardiac problem is we must start at a very young age for our children. All of us have a myth that children should take fatty foods because it is required for their growth. Yes, fats are very important for children and for us also, but in moderation. As young as 7 to 10 years old children, they can start depositing cholesterol or plaque in the arteries of their heart, which in long way can lead to cardiac problem at a very young age. I would also like to mention that in today's time, a lot of people who work out in the gym, they are getting cardiac problems not because of workout in the gym, because they ignore their health, and suddenly when they work out, they get a cardiac problem. We must understand that, especially after the age of 40, we must get our regular blood test done. In today's time, our environment is such where the nutritious value of our food is very low. The use of palm oil, the use of fats which are not healthy for our heart is very high. Our sedentary lifestyle, the stress factors, the consumption of alcohol, smoking, all of these things have contributed to heart problems at a very young age. The problems are initiated, but they come out once you give any kind of stress to the heart, like workout. So workout is very important. A brisk walk of 30 minutes every day is very important to keep your heart happy and healthy. But at the same time, make sure we get our parameters tested very regularly. Secondly, the way Dr. Deepak Puri organizes singing and fashion shows, that's just to come out of the regular routine of work. We must follow our hobby. It is very important to follow our hobby so that we can keep our heart healthy and the stress that we have in daily time can be overcome. Workout is very important in any form, like walking, yoga, exercise. It makes your body release endorphins, which are the happy hormones, which will keep the heart happy. Lastly, I would only like to say that analyze the risk factors that can give any kind of stress to your heart and just remove them. And you would see a lot of change in your life. Plus, we must understand what is our role in the society, why we have come in the society. Our half of the stress would get removed by understanding that how meditation, how workout, how being happy and satisfied internally without having any comparisons with others can give us happiness and can reduce our stress. Once again, thank you so much, Dr. Deepak Puri, for letting me in a panel. And I would like to apologize, I am not able to come today, but I will always be associated with Cardiomersion. Thank you so much.
I am Harsha Nihalani, a yoga instructor and a Garbh Sanskar coach and integrative clinical nutritionist from Mumbai. So today for panel discussion, I want to talk about the benefits of yoga and incorporating yoga with other modern modalities like Pilates, Zumba, and influencing the youngsters to get more inclined towards yoga. Now, how can we do that? Now, yoga is so powerful than other modern modalities. It is not very slow. That is the myth among youngsters. So firstly, we really need to understand and educate these youngsters that yoga is not that slow, traditional practice, a boring practice. Rather, it is a very, very powerful tool, a science which incorporates the yogic wisdom of how you can tap into your own body's energies and create the beautiful health out of it. The health that you require, the goals that you write on your to-do list that you want to achieve, this is easily achievable through yoga, but you need to educate yourself on that. So, being a young student, when you take up a chance to go into a yoga class, choose a yoga class which help you understand the science behind it rather than really putting up the superficial surface knowledge. Now, when we do that, we understand that yoga is inherited from the rishis from thousands of years and how it has transferred to modern generation and why it is influencing the health. It has deeper layers, like this is just a physical body, but do you know, being a young Gen Z, that your body is just not made up of this physical muscles, bones. It is made up of beyond the layers that you can see today. So a body is made up of 5 different layers: physical body, then there is a subtle body, then there is a causal body, there is a mental body, emotional body, and a super causal body. These bodies are not visible to your eyes, but yoga, through the wisdom, through the asanas, pranayams, we tap into it and you activate the inner superpowers. So you see those Superman, you see those other superpower heroes, That lies within you. You just need to know that I have to tap into it and get access to all the hidden powers within you.